Good morning and welcome to this live event organized by UNAIDS Asia and the Pacific in collaboration with the Foreign Correspondents Club of Thailand. This is an event which is organized to commemorate the launch of a new report by UNAIDS called Global Commitments, Local Action After 40 Years of AIDS, Charting a Course to End the Pandemic. 40 years after the first case of HIV was detected, and 20 years after the first political declaration, UNAIDS has launched now a report that provides an update on where we are with regard to the response to the epidemic globally and a call to renewed commitment. This event will allow us to discuss some of the key messages from this report, highlights some of its content, the learnings from it, and we will be able to discuss with governments, with community organizations about some of the key learnings coming from the situation of how Asia and the Pacific has managed to respond to the epidemic. We have a panel of invited individuals here, esteemed panelists, which I'm pleased to introduce with us. I would like to first welcome His Excellency, Mr. Eamonn Murphy from Cambodia. Mr. Eamonn Murphy, welcome. Mr. Eamonn Murphy is a senior minister in Cambodia. He is chair of the National Committee on AIDS, and had a long history of doing great work and sharing in the government since 2013 and chairing several committees in the country. He had been involved and leading in the national response for very long in Cambodia. We have also Mr. Eamonn Murphy, Regional Director for Asia and the Pacific. Mr. Eamonn Murphy is the Regional Director for Asia and the Pacific based in Bangkok, and he works with the countries and leads the UNAIDS response in the region from Afghanistan to the Pacific, in achieving the goals outlined in the political declaration towards ending AIDS. He works a lot with governments and leads and facilitates the joint United Nations response to support countries and their HIV programs, which includes strengthening the collaboration between government, civil society, and the UN system and development partners. Mr. Murphy had served as UNAIDS country director in several countries and has led the UN system and has led the governance of the UN system and donor relations department at the global level. Before joining the UN, Mr. Murphy has led a number of senior positions with the Australian government, including in the Australian Agency for International Development and the Commonwealth Department of Health. Mr. Murphy, you are now in New York, I understand. I will come back and introduce our other two speakers. And as this event, as this launch happened today, earlier today in your time, could you please come in and tell us some of the key messages coming from this report and why it is so important at this stage, 40 years in the epidemic and 20 years after the first declaration? Mr. Murphy, over to you.
Thank you very much, Tawfiq. Firstly, it is a privilege for me to be with you here today. Yes, I'm in New York for a number of meetings in advance of the high-level meeting, but it's a great privilege to be with Senior Minister Eamonn Murphy, a long-standing committed partner in the response to HIV in Asia and the Pacific, not just in Cambodia. Jules Kim, who's the civil society representative for Asia Pacific on our board, the program coordinating board. Ika Novianti from Youth Lead from Indonesia. It's great to be with you all. Distinguished participants and guests, it is my great pleasure to welcome you to the regional launch of the report, Global Commitments, Local Action, Building on 2 Decades of Global Solidarity to End AIDS. As the world prepares to mark tomorrow the 40th anniversary of the first reported cases of AIDS, UNAIDS has launched this new report to outline the latest global trends in the HIV epidemic. The release of the report is timed just days before countries come together virtually here in New York to adopt a bold new political declaration on AIDS as part of the United Nations General Assembly high-level meeting on AIDS, which will be held 8 to 10 June here in New York. New data from UNAIDS does show the positive news that dozens of countries have achieved or even exceeded the 2020 targets set as part of the United Nations General Assembly in 2016. It's evidence that these targets were not just the aspirations of the member states, but also achievable. The targets are set, the commitments made as part of these political declarations by a consortium of government, of community, of civil society, and technical experts, as our panel today represents. The report shows that countries with progressive laws and policies with strong and inclusive health systems have had the best outcomes against HIV. In those countries, people living with and affected by HIV are more likely to access effective HIV services. This includes testing, pre-exposure prophylaxis, which is groundbreaking in many countries. It's using medicine to prevent HIV. Harm reduction, multi-month supplies of HIV treatment, and consistent quality follow-up and care. The report acknowledges that the world has made incredible progress, particularly in expanding access to treatment. 27.4 million people of the 37.6 million people living with HIV were on treatment in the year 2020, which is a significant increase from the 7.8 million people who were on treatment in 2010. This represents an increase of more than 250% over the last decade. This has helped reduce AIDS-related deaths significantly, improve the quality of life for these people living with HIV, who then lead normal lives and live the same lifespan as the average person in society. Deaths have also declined over that period by 43% in that decade. But we do need to do more. The HIV epidemic still threatens the world and the successes achieved to date. The COVID-19 pandemic has further pushed back the gains made in ending AIDS. 1.5 million people were newly infected with HIV in 2020 alone, and global targets for 2020 have been missed in many places. In our own region, Asia and the Pacific, the HIV epidemic is expanding faster than the response, with only a 12% decline in annual new HIV infections and only a 37% decline in AIDS-related deaths since 2010. So we are behind the global average, and 10 years ago, the region would have been at the forefront of the response. So we have a lot to do. And that's why this new political declaration and the new commitments that the countries of Asia Pacific will also sign up to is critical for us to move forward. The region has not achieved the 2020 targets, so renewed commitment, renewed action is vital. In the Asia Pacific, HIV prevention continues to fail to reach key populations in significant manner. Key populations and partners account for 98% of all new HIV infections in the region. Treatment coverage is also stagnating. Almost 40% of people living with HIV are not receiving the life-saving treatment that they need. The report underscores that globally, countries with punitive laws and those that do not take a rights-based approach to health leave key populations on the margins and out of reach of HIV and other services. Gay men and other men who have sex with men, sex workers, transgendered people, people in prison, and people who inject drugs are left with little or no access to health or social services, allowing HIV to spread among the most vulnerable in our societies. COVID-19 has further threatened our progress towards ending AIDS as a public health threat. As the world grapples with the COVID-19 pandemic, access to HIV services has been disrupted. In our region, the uptake of HIV services was reduced last year due to the fear of contracting COVID. People did not go to services. There were movement restrictions and lockdowns. People living with HIV were also locked down in households where others were unaware of their HIV status, and they feared discrimination if they disclosed this status. Data across the region show a reduction in treatment levels in the first half of 2020 compared to 2019, the year before, meaning that fewer people were able to access and receive the life-saving treatments and medicines for HIV. In some cases, this was a service disruption for people on long-term access to ARVs, and the potential for drug resistance increases. COVID-19 has shown the fragility of the health and development gains made over the past decades and has exposed increasingly glaring inequalities. We need to urgently act against both HIV and COVID-19 at the same time. Civil society organizations have been at the forefront of the response at country level, providing HIV services to communities that need it most. However, these efforts need to be complemented and supported to ensure access to prevention services for key populations remain a key priority. We see worrying signs of retrenchment on spending on global approaches to health. This would be a mistake. Robust systems for health protect the global economy. So the world cuts investments to health at its peril. Realizing the right to health is the bedrock of sustainable growth in every country. Ending AIDS as a public health threat is possible, but a renewed commitment and course correction is needed to make it a reality. In our region of Asia-Pacific, key priority actions are needed. Firstly, to renew and intensify the focus of policies and programs on rights-based approaches to reaching key populations where they live. Modernizing HIV service delivery, including scaling up of PrEP, self-testing, other innovations such as use of the virtual space to reach people, and differentiated service delivery, including multi-month dispensing of both prevention and treatment services. To eliminate the barriers to equitable service coverage amongst the most marginalized populations, and to mobilize sustainable domestic financing, particularly for prevention. Colleagues and friends, to get the world on track to end AIDS by 2030, the global AIDS community and UNAIDS have used an inequalities lens to develop an ambitious and achievable strategy with new targets to reach by 2025. UNAIDS urges the United Nations General Assembly, the member states, the countries of our region and across the world to commit to the targets in the new political declaration that's currently being considered. We ask governments to commit to taking a people-centered, rights-based approach to HIV, to seize the moment and commit to taking actions needed to end AIDS. Thank you for your interest and commitment.
Thank you so much, Eamonn, for this summary. Clearly great messages and learnings that are coming up in this report. 40 years in the response and 20 years after the first political declaration. Lots of achievements, but we understand that there are lots of gaps. The AIDS epidemic is not over, and there is need for renewed commitment and renewed action. Basically, with stronger adoption of innovations and comprehensive models of service delivery. And we acknowledge that the report also highlights the threats that are brought up by the pandemic, the COVID-19 pandemic, and we will have opportunity to discuss. I would like now to come back and reintroduce properly our esteemed panelists, starting with His Excellency Mr. Yang Moody, Senior Minister and Chair of the National AIDS Authority of Cambodia. Thank you for joining us, sir, today. Mr. Yang Moody is currently the Senior Minister in charge of Special Mission in the Cambodian government, and he is Chairman of the National AIDS Authority. He took office in October 2013. Prior to taking up this current position, the senior minister held many positions of high responsibility, among which being chairman of the Government Council of the Cambodian Mine Action Center, Minister of Information, and member of the National Assembly. Member of the Supreme National Council, and from January 2014 to April 2018, His Excellency had been the chair of the Country Coordinating Committee of the Global Fund to fight AIDS, tuberculosis, and malaria in Cambodia. Welcome, sir, and thank you for joining us. Our other speaker, Ms. Ika Novianti. Thank you for joining us. Mrs. Ika is from Indonesia and is the advocacy officer at Youth Lead. Ika has experience working with key populations network at both national and regional levels. In her role as the advocacy officer, Ika is represents the Youth Lead at various workshops, consultations, meetings, forums to ensure that the needs of young key populations are being met. A very strong advocate indeed. She also provides technical support to country partnered organizations and ensures meaningful engagement of Youth Lead focal points. Currently, she is part of the developing country NGO delegation and represents young key populations in Asia and the Pacific as a youth council in Global Fund. Welcome and thank you for joining us today. Our next speaker and panelist is Ms. Jules Kim. She is the CEO of Scarlet Alliance, Australian Sex Workers Association. She is the chair for the Regional Sex Worker Network, Asia Pacific Network of Sex Workers, and is the UNAIDS Program Coordinating Board NGO Delegates for Asia and the Pacific for the biennium 2019-2021. She is a representative on the multi-stakeholder task force to the 2021 high-level meeting on HIV/AIDS. Jules represents sex workers on a number of government committees and advisory mechanisms and has provided testimony and expert advice to the parliamentary hearings and inquiries in relation to sex work, migration, trafficking, and law reform. She has over 20 years experience in advocacy, community development, and representation on behalf of the sex workers community. Welcome, Jules, and thank you for joining us. So we are honored and pleased to have His Excellency Yang Moody representing Cambodia. And we know Cambodia for being one of the best performing countries in the region, having achieved the 2020 targets for the 1990 treatment targets, and also is doing very well according to the indicators related to prevention. Mr. Moody, UNAIDS has proposed ambitious and achievable targets for 2025, and it has developed a global strategy for achieving them, recently launched. High-performing countries like yours share vital features: strong political leadership on AIDS, adequate funding, genuine community engagement, rights-based and multi-sectoral approaches, and the use of scientific evidence to guide focused strategies. In this regard, we would like to ask your views. Cambodia is among those high-performing countries that have achieved the 1990 targets by 2020. Building on your own country's success, how is Cambodia strengthening its HIV response to achieve the new, more ambitious targets moving forward towards ending the AIDS as a public health threat?
Well, thank you, Mr. Sophie Bakali and Mr. Eamonn Murphy, for your kind word of introduction about myself and about Cambodia efforts in multidisciplinary HIV response. I am really pleased to join the today panel discussion so that I can present the program of HIV in Cambodia. In fact, Cambodia is one of 7 countries, as you rightly pointed out, globally to have achieved the 90-90-90 target in 2017. Currently, out of 75,000 PLHIV countrywide, 85% of people living with HIV knew their status. Of those, 99% were accessing treatment, and among those on ART, 97% were virally suppressed. For strengthening its HIV response to achieve the 2025 target toward ending AIDS as a public health threat, Cambodia focused on key important areas. First, strong political leadership on AIDS. Second, adequate funding. Third, genuine community engagement. And fourth, rights-based and multi-sectoral approaches. And fifth, the use of scientific evidence to guide focused strategy. On the strong political leadership, our current Prime Minister, Samdech Techo Hun Sen, has called for a national movement to engage a national and subnational response to end the AIDS epidemic. This strong political will needs to be translated into reality with the application of the dynamic of stakeholder participation of our national development strategy called the rectangular strategy that assists different sectors to collaborate and share responsibility in the last battle against AIDS. Leadership at all levels should decode the principle of the fifth National Strategic Plan for comprehensive multi-sectoral response to HIV/AIDS 2029 to 2023, or NSP5, to contribute to the achievement of 95-95-95 target with a dynamic, integrated, and sustainable response to AIDS. Leadership at provincial, subnational level are equipped to own their local response. The National Strategic Plan 5 focus on multi-sectoral aspects involving multiple government ministries and partners to effectively engage in the HIV response. The effort of different ministries, coordinating body, and partners will be guided by implementation arrangement according to their specific sectoral indicators or achievement of NSP5 strategy and sub-strategy. To align the HIV response with government policy and reform, leaders need to strengthen country system at national and subnational level by making use of the right data, the right tools, and existing network and mechanism to critically contribute to ending the AIDS epidemic. Starting from provinces that signed fast-track city agreement, we are strengthening subnational system, province, district, commune, to develop their own strategic plan, followed by budgeted annual activity plan. Second, adequate funding. With its graduation as a low middle income country in 2016, Cambodia is transitioning toward building a country system for a sustainable HIV response based on the result of the investment case and the recommendation of the transition readiness assessment and the sustainability roadmap. Responding to the commitment of financing to 50% of all HIV expenditure by 2023, all allocate a move toward sustainable financing of HIV response. A recommendation letter number 213 of the Council of Ministers issued in February 2019 gave a directive for key sectors such as health, social protection, and also a share of the government budget to civil society organizations for delivery and critical HIV services and the decentralization of the response to local level in the context of declining donor funding. We have started to co-finance the Global Fund program, such as 2.5 million in 2019 and 3.5 million in 2020 and 5 million in 2021. In addition to the allocated co-funding budget required by Global Fund grant, efforts have been made to include all PHIV under social protection scheme to secure front-loading investment for the AIDS response. Over the next 5 years, concerned institutions need to translate the recommendation letter number 213, which seek policy measure to generate domestic funding to support an effective and efficient HIV response at national and subnational level. Genuine community engagement. Evidence show us that the Cambodia epidemic has grown much more complex as HIV risk and vulnerability are rapidly changing. Hence, community engagement for the AIDS response need to be much more strategically tailored to meet the needs of all at-risk and vulnerable people, especially those who are hard to reach, with differentiated prevention and care and treatment model. We need to continue to support civil society organization and community mobilization effort to critically complement government effort. At all levels, the success of the response depends on good coordination between government institutions in active partnership with non-governmental civil society organizations and key population. To engage representatives of KP-PL-HIV networks at all coordination levels is critical for timely action to address risk behavior change or to appropriately respond to community need. Right-based and multi-sectoral approach. Cambodia is committed to urgent and transformative action to end the social, economic, racial, and gender inequality, punitive law, policy and practices, stigma, and multiple and interesting forms of discrimination, including based on HIV status and other human rights violations that perpetuate the AIDS pandemic. To leave no one behind, local authority, police, healthcare worker, and social worker should apply people-centered approaches to emphasize the necessity of listening and learning about stakeholders and collectively remove human barriers, enabling key population and people living with HIV to have access to quality services in an equitable manner. In this regard, PL-HIV and KP have been selected by their peers to be included in government mechanism for HIV/AIDS response at subnational level to allow them to raise their concern on their rights in routine coordination meeting. In hotspot provinces, training will be expanded to enable police and local authority to take action with healthcare providers to address stigma and discrimination against KP. We are committed to continuously sensitizing law enforcement officers on the harmonization or implementation of different laws which may impact KP and PL-HIV. The use of scientific evidence to guide focus strategy. Cambodia underscores the critical role of science, including biomedical and clinical science, social and behavioral science, and political and economic science, and evidence-based approaches in shaping the direction of and accelerating the HIV response. The National Strategic Plan 5 monitoring framework is built on indicators that are already being collected regularly, such as the National AIDS Spending Assessment, the Global AIDS Monitoring Report, the Stigma Index, Joint Monitoring Indicators. Indicator for monitoring the implementation recommendation letter number 213 have been finalized and will be rolled out to fast-track city provinces. Granular strategy information will be collected to address gap, prioritize investment, and introduce innovative programming approaches to prevention, treatment, care, and support. So far, Cambodia has been implementing evidence-based interventions such as 100% condom use program, treatment as prevention, post-exposure prophylaxis, prevention of gender-based violence, harm reduction including needle syringe program, and opioid substitution treatment. Innovative interventions such as pre-exposure prophylaxis, HIV self-testing, resistancy tests, social media for behavior change, and demand creation have been expanded.
Sir. Thank you so much. Very comprehensive and excellent. It's very impressive, the comprehensiveness of the components being addressed and considered in the Cambodian response. As you rightly said, use of evidence, use of latest technologies, and working and using the right data and the right tools and working with the networks and communities to implement the national strategies clearly makes a difference. As we take note of increased investments, increased variety of models. This is really good. Thank you, sir. We might come back to you for possible further questions. I would like to make a call at this stage to all those following up live on Facebook. Please feel free to type in your questions to any of the panelists, or if you have any question or query or seek clarification, please feel free to type your questions on the live chat. I would like to turn now to Jules. And just reflect on a specific component that has also been highlighted in the report, which is the vulnerabilities caused by COVID-19, particularly in the past year. We know it has led to a lot of disruptions in service delivery and caused a huge hardship on many communities and populations. The response to COVID-19 pandemic has underscored also the importance of community-led organizations in navigating these difficult times and rapidly changing the environments and reaching affected communities with essential services, such as COVID-19 testing and vaccination, HIV prevention, testing and treatment, and other health services. How, from your perspective and experience, how are communities and civil society responding to COVID-19 to promote access to HIV services in Asia and the Pacific?
Thanks for that. So we have seen that the significant gains that were made in the HIV response, such as the creation of and centering of community-led approaches to health, had a direct positive impact on key populations during COVID. Unfortunately, we also saw that the structural barriers that have persisted in HIV also meant that many vulnerable communities, in particular key populations, were left behind in COVID. And for key populations, the intersecting issues of sexual and mental health discrimination, violence, and economic disparity, and these challenges were to the health and human rights of many key populations became exacerbated during the COVID pandemic. For many key populations, being forced to live and work on the margins as a result of being criminalised or targeted just made it struggled to survive amongst the turmoil during the pandemic. So it served to kind of exacerbate the economic instability, violence, and stigma and discriminations that key populations face, and already restricting faced severely restricted access to prevention, treatment and care, and severely reduced access to health services and treatment, including for treatment and for PrEP and health commodities as a result of a closure of many community health clinics, as well as repurposing in terms of the health system for the COVID response. And things that, the impacts that we saw were, inability to access necessary harm reduction services for people who use drugs, and really limited or no government support or inability to access those supports. And for many key populations, not having ID to access government support, even if it was available. We saw an increase in gender-based violence and key population violence against key populations. Also, the impact of restrictions of movement for key populations and people living with HIV in accessing HIV prevention and treatment, and with limited or no access to personal protective equipment as well, and closure of those necessary services. And so, unfortunately, for many key populations that have been rejected from family and community, also had no supports in this environment as well. So, what was really critical during this time was the ability for community-led organisations, so for the key population led regional networks and their member organisations in the countries, were able to pivot in order to meet the needs of key populations across the region. And I think this was really critical to show that they were able to immediately respond to the pandemic by modifying existing programs that already access key populations to meet these urgent and immediate needs, and to reach most vulnerable members of our community. So we saw that our programs that reallocated existing program funds to deliver essential food aid and to subsidise emergency housing as well, and to ensure that people were able to access their ARVs when we saw the restriction of movement and closure of public transportation restricting access. And community-led organisations were also able to start mutual aid funds and emergency fundraising efforts for people who couldn't access any government emergency support. And I think the relief that was provided by these community-led organisations demonstrated that they're best positioned to support key populations and the most marginalised during crises like the COVID pandemic. And this is because of those connections and the trusted peer networks that are already established in the HIV response, and also their outreach capabilities. I think those experiences of the community-led organisations also provided a number of important lessons for other health emergency responses moving forward as well. It demonstrated that the community-led organisations really are the most effective medium to reach key populations during an emergency. We're able to do rapid assessments, identify priority areas, and reallocate resources to provide necessary emergency assistance where it's needed, and access to medicines and essentials like food and accommodation. Having established peer-to-peer models led by knowledgeable and trusted peer workers enabled them to be able to deliver critical aid and prioritise those most in need of assistance. And I think that understanding of where the community needs are and where the critical gaps are, and and the ability to be able to reach those populations to respond to those needs have been critical and unachievable without that community-led mechanism and support. I think we also saw UNAIDS had supported key population networks to also to develop and promote access to relevant and timely information to share and record these best practices from the community-led responses. And there's some excellent reports by APCOM and a number of the regional networks in documenting these innovations and the strengths within the communities in responding to the pandemic. What we saw, though, unfortunately, within the consequences that services were being unavailable or inaccessible or unaffordable because of the pandemic and the restrictions measures that were put in place to curb the pandemic. And we also, unfortunately, saw many community-led organisations having to close operations because of a lack of funding. Fortunately, there was, support to repurpose and appreciate the donors that were able to, that enabled community-led organisations to be able to repurpose fundings to meet the emergency needs of their community. But unfortunately, we also saw many community-led organisations having to close due to a lack of sustainable funding. And we unfortunately also saw the, exacerbation of discrimination and marginalisation and that burden on community. So I think it has really amplified the need for community-led responses in the HIV response, but also in being able to respond to other public health emergencies like COVID-19. And we also need to ensure that sustained funding to enable community-led organisations to be able to continue to do this essential work.
Jules, I would like to highlight this last message. Community leadership and community response is not only for HIV. The COVID context has proven that it can be extremely impactful and valuable for responding to all kinds of threats and pandemics, as well as it brings in the solution. So this has to be sustained and invested upon to strengthen the response. Now, I'd like to move and discuss a little bit with Ika, representing young people, strongly engaged on young people needs and matters, strong advocacy. And building on that last point with regard to the community engagement in responding to COVID-19, which is a strengthening of the HIV response, which we were calling for a very long time. So the COVID-19 pandemic has underscored the importance of community-led organizations in reaching affected communities, and particularly those who are further hard to reach or marginalized or remain hidden for obvious reasons. And we all know young populations, young key populations particularly, are particularly in this case. So if we reflect on the past year, what are some of the youth-led initiatives you might be aware of that are worth highlighting? I am sure we will find plenty of good examples. We'd like you to bring those to the front, please.
Thank you so much for that. So as the pandemic started hitting hard last year in 2020, firstly, Youth Lead and the interagency task team Asia Pacific work closely with network and partners, stakeholders, and also the UN agencies to conduct need assessment on how COVID has affected young key population to identify additional support areas for YKP. So the assessment result found challenges pertaining to disruption in HIV services, increasing mental health problems, socio-economic problems, including lack of basic needs food, like food, proper shelter, and etc. So in order to respond to this situation, Youth Lead reach out to existing donors and request for the fund reallocation to create the Yankee population COVID-19 emergency relief fund. So the Robert Card Fund, one of hugely prominent donors, agreed to the proposal and approved the reallocation of program costs to COVID-19 emergency relief fund. Besides, also we got support from other agencies such as AHF and UNAIDS. So the fund was disbursed in 2 phases, reaching out 11 organizations in 9 countries. So the key programs supported were providing essential package for YKP, harm reduction services for young people who use drugs, ERV support home delivery, and also mental health support program. So, and also this year in different countries we're having like second wave or third wave. So we decided to launch emergency relief fund for phase 3, and currently we still currently we're still reviewing a concept note that we received. So.
Ika, this is really good. And it's really important to continue empowering communities of people living with HIV, women, adolescents, young people, everything, and key populations, of course, in the HIV response. So if I would like to follow up, and I know you are an advocate and you have been contributing in several forums and advocating for stronger engagement of particularly young populations. So what is needed to guarantee young people are meaningfully engaged in the HIV response as beneficiaries, partners, and leaders in the response?
So to ensure the young vulnerable population meaningful in participation, as my understanding, we need to identify 3 main things. So first of all, we have to have supporting mechanism such as internal external policy and or any guideline to ensure that young people should be part of in each and every process of decision making, implementation that affect our life. As a young person who work with young population, in every discussion, country leaders keep mentioning that we do not have enough space to include in the decision making, and again we are keep pushing regional mechanism to have type of advocacy to the government. International organization, regional network can do better advocacy jointly to solve this barrier for young people. And secondly, it has to have support system to capacitate young people to be able to engage and contribute meaningfully, and also in information like distribute information and knowledge together can build power. I said this because of young people. We are a diverse group with different unique of needs. So we really need to receive all the information about the program so we can engage and represent our community better. So the final one, I think this final is slightly broader. For example, the patriarchy system. So the dynamics of being younger connotes to being junior, so or subordinate or etc. And often young people are not taken seriously. In other hand, young people have difficulty in voicing out their issue more openly amidst their senior counterparts.
Thank you. Very powerful to use the energy and the competency and the capacities of young people in the response and support them and give them the opportunities and the space to engage, recognizing their ability to lead because they have that ability. Very strong message there. Ika, thank you so much. I would like to again make a call to all those following us live. Please feel free to send your questions to any of the panelists, and you can see the diversity of profiles we have here. So let us make use of that. I have a question for Jules, and that's to the access to HIV and sexual and reproductive health services that particularly as in many cases, these are hindered by gender-based violence and the limiting of their agency and decision-making power for women. So how are community led organizations in Asia and Pacific, at least from your perspective and your knowledge, how are these community-led organizations leading on this effort to tackle gender inequality, which is a very important element that determines many aspects of the AIDS response?
Thanks for that. Yeah, that's a great question. And, you know, unfortunately, we did see a real increase in violence against, in particular, around key populations, particularly sex workers and also transgender people, and also increased violence by police, and the impact of loss of income due to, as a result of the pandemic, also had a massive impact on key populations. And this, I think, what we did see in response was some really amazing responses at that time to ensure that there was social counselling and legal supports, as well as you know, leveraging existing supports to provide emergency assistance. And that we saw many of the member organisations repurposing some, you know, emergency funds to provide accommodation for people who lost their housing, or, for example, who were living in their workplaces and lost housing as a result of their workplaces closing as well. So that was really important to have that. What we also saw was that, you know, in particular with sex workers with no family and social supports that didn't have anyone to help them, that community organisations were able to provide that support and actually become a family for them, to provide that mental support and those support networks during the pandemic as well. And I think there was a great example as well of APNSW managed to repurpose funds to give out gift cards, gift vouchers in sex work areas as well, for sex workers who'd lost clients due to the fact that, you know, the restrictions in place. And we also, there was also this groups in terms of is empowerment, to empower women to overcome these challenges and to build skills and capacities. And there's safe forums to discuss sensitive issues, but also strategize and to help reduce like fear and misconception and stigma and discrimination associated with being a member of key populations such as sex workers and also HIV within the community. And a lot of the advocacy of the community-led organisations was to ensure that government, to advocate to government for access to sexual and reproductive health services, as well as HIV services, to ensure that that key populations had access to those essential supports and services during that time.
Thank you, Jules. Great examples, and it demonstrates variety of options and ways of doing, from simple to strategic and comprehensive. Really good. I have a question for Mr. Eamonn Murphy, and that's regarding the scale up of combination of prevention measures in the region. So what is needed to scale up combination prevention in the region, particularly for key populations, as it seems that the region is lagging behind in its prevention efforts?
Great. Thanks very much for the question, Taufik. There are a combination of issues that are needed. Firstly, of course, funding. That's critical, and it must be domestic funding, must be sustainable. We heard His Excellency Minister Yang Moody talk about the role of civil society. The response in Cambodia is more complex, so he's relying on a partnership with civil society. There needs to be institutionalized social contracting so civil society organizations can help deliver, because if you're trying to reach marginalized people who are hiding in the community, the most effective people who can reach them are people from their own communities. Ika was talking about young people. Who best to reach out to young people but other young people, using the platforms that they use, the internet, mobile technology, platforms that people of my age just don't use it, and we're not connected to. So they don't want to go to fixed site services. They want to hear the information where they are most comfortable. And stigma and discrimination is one of the biggest issues. These all come together. When we talk about combination prevention, we need testing, and we need to then help people stay HIV negative, protect themselves, take prevention measures like PrEP, make it easily available. A number of countries are now rolling out PrEP, but it's not at the scale that's needed to have an impact on the epidemic. And we're seeing the rising numbers across the region are in young people. And it's a new wave epidemic in many of the countries, and that's what's impacting. But then we also need, from that testing side, to go through to treatment. We need to bring the programs together and not have them as though they're separate programs. The innovation that's come through with COVID, the really good examples of home delivery, multi-month dispensing of both ARV treatment, of pre-exposure prophylaxis medicines, of other prevention commodities, but also of opioid substitution therapy like methadone, home delivery, home dosing. These are new innovations that must be institutionalized as well as we move forward. Take the advantage of the negative impact of COVID and the response by largely governments in partnership with community about innovation and change. That needs to be scaled up and maintained. And that's why social contracting is a critical element. Alongside that is the policy and legal environmental changes that need to be made so people are not afraid to disclose anything about their lives when they go into health services or other government sites or other programs. So that's why it's called combination. It's not a single issue. And we need to make sure that it's at the scale that will have an impact on the epidemic, or we'll see more countries with rising epidemics like the Philippines. Unfortunately now, one of the fastest growing epidemics in the world, and definitely the fastest growing in our own region, yet was one of our success countries only years ago. So this is a real challenge for the countries. That's why combination prevention is critical. Thanks very much, Toby.
Thank you very much, Mr. Eamonn. I have a question for His Excellency, Senior Minister, Mr. Moody. Probably that would be the last question for the day, as we are on the time. It's a question from someone from Cambodia who wished to know how to respond to maintain PHIV in keeping them to access their ART on time during the COVID-19 period, particularly as there are a lot of household of PHIV in poor condition who lost income, etc. I would place this question in a broader perspective about protecting the gains. Cambodia has achieved very well, and there are risks because the achievement so far need further investment to be maintained and sustained. So how can you please respond to this question? What are the strategies considered to sustain the gains in Cambodia?
Well, thank you. Thank you for the question. It is very difficult in the time of COVID-19 to maintain the gain that we have obtained from the previous years. But the government is working very hard to protect the people living with HIV by providing a multi-month medicine distribution. And also the government is providing cash to those people because we consider that they suffer more than other people. And they are now identified as poor people. And we will see the development of the situation during this COVID-19. So this is what I can tell about. I can answer the question, but in other views, I would like to express the following. With the support from UNAIDS, a mathematical modeling of optima or business as usual for HIV intervention from 2019 showed that 90% reduction in new infection from 2010 by 2025 target is not on track. Uncertainty in funding for HIV prevention program leave Cambodia at risk of new infection. Besides COVID-19 pandemic hampers preventive intervention. Epidemiological data show that new infection tend declining trend in general, but the rate of decline has stalled. However, MSM and TG as a proportion of total new HIV infection is expanding from 12% in 2010 to 54% in 2020, especially among young key population. Moreover, it is to notify that key population and their clients account for 71% of new HIV infection in 2020. Cambodia is committed to averting new infection to less than 250 by 2025 through tailored and customized prevention intervention and intensified target case detection to achieve the first 95. To meet the need of key population, combination prevention program has been tailored and scaled up to specific groups. These are boost differentiated prevention services through customized and innovative intervention, including micro-targeting modality to improve reach and avert or find new infection. Scale up differentiated testing strategy through a mix of provider-initiated, client-initiated, community-based, and facility-based testing modality. Prevention and HIV testing services will maintain a focus on at-risk key population. Formal entertainment worker, MSM, TG, and PWID. ATS will remain available through the public health system, and HIV/ST self-testing will be expanded. Directed outreach services for KP will be more targeted to key provinces and peer-driven intervention plus PDI plus for new case detecting among KP. Social media further supported, expanded, and diversified, including self-assisted online services in accessing offline support to reach hidden MSM and hard to reach TG and high-end entertainment worker. Virtual outreach services and counseling to mitigate continuing impact of the COVID-19 pandemic on coverage of full outreach services. Micro-targeting PrEP expansion to more provinces for reaching 10,000 key population by 2023. Despite all this difficulty, we are determined to move from dependency to resilience and eventually self-dependency.
Moving from dependency to resilience. Excellent final words, and thank you so much for the comprehensive contribution. We have reached the end of our event today, and I would like to thank you all those who joined us live and interacted and shared their questions and feedback on the interventions of the panelists. First of all, thank you, Your Excellency, for giving us of your time despite your very busy schedule, and thank you for the comprehensive sharing of information from the experience of Cambodia. Eamonn, thank you. I know it is very late for you, New York time, and thank you for joining us in this live event. And then thank you, Jules. Really great input, great information on behalf of the community you represent. And thank you so much, Ika, proudly representing young people. Thank you all for joining us. And I would not close without thanking the professional partnership with the Foreign Correspondents Club of Thailand, who facilitated in streaming this event, and it's a very professional viewing and facilitation and information technology. Thank you so much. Thank you all, and we look forward to seeing you in another event pretty much soon. Thank you. All the best.
Bye-bye.
Right.